usually your gloves after surgery, your sterile gloves will be bloody, so you always want to have a backup of non-sterile gloves here for when you do the pressure dressing on the patient. After that, those might be dirty again, so you want to always have like at least 2 extra pairs in the room. Once the patient has left, you're going to start cleaning up, so you want to go ahead and first remove all your sharps. So I will go ahead and lift this up so I can get a clear view. I will go ahead and dispose of everything here. And I'll start looking for my sharps. Sharps you want to be aware of. Bifurcated tip. So I'll go ahead and remove that. Put it to the side. Usually, the blue sutures would be on the needle holder. Like that. So you want to look for these. And it's usually going to be, doctor will use most of it. So it's going to be like that. So you want to look for this one. Go ahead and grab it. If you don't want to grab it with your hand, you can use the pickups to grab. This one you would go ahead and grab, let go, place it there, and then your scalpel. So the scalpel, we want to remove the blade. We do have a blade remover. So what I'm going to do first is just be aware of those sharps. Grab one of these. If you don't want to grab them with your hand, you can do pickups or the needle holder. You're going to go ahead and place them all here. Close this to let it go. Those sharps are done. The only thing we have left is the blade. So we're going to carefully grab it. And we have our blade flask here. It tells you how to remove it. So sharp side to the right. If it's like this, sharp side's here. So that's wrong. So we always want to do that way. And you insert it right in here. You're going to hear the clicking noise. You can pull out, blade done. Okay. Now you want to go ahead and grab all your dirty instruments, which are going to be your scissors, needle holder, and you never want to grab them from here because there's going to be blood everywhere. Grab them from the bottom. Grab these. You don't have to grab them all at the same time. You can grab one by one. This is where we put our dirty instruments. So there's some dirty instruments here. I left these here on purpose. They're not actually dirty. They're just clean for demo purposes. But usually we never want to have any dirty instruments here. If we do, we'll just place these here. Close it. And now this is all trash. There's no more sharps and there's no more instruments. So I'll go ahead and grab the bifurcator. When you're doing this, you want to make sure that you're being, one, very careful to not press these buttons. If it's on, you're going to shock yourself. It hurts. I haven't had it personally done, but I've heard that it hurts. If you're afraid of pressing it on accident, just go ahead and turn it off. Go ahead and remove it. And then we're just going to place it right here because we need to clean it. This, you can go ahead and lift your nail stand. This will not get blood in it, but we still dispose of it. Okay. This area, what you're going to do, make sure you know where your specimen is at. So I always put it close to my iPad. I'll grab all my concerns, put them close to my iPad, and I can start removing all of this. So there's the patient. Let's say they didn't want to take it. This way. Patient never touched this. It was only us, clean gloves. Okay? Any gauze that wasn't used, throw it. If you're not sure if it was used or not, just throw it away. Honey gel, back. Keep it close. Back. Back. Any lidocaine that was not used. You can leave it here, or you can take it back to the lab into the bag. Okay. if you use this ruler, you throw it away. And then you clean the room like you usually would. Okay? So let's start. You can start recording.